Hey guys, welcome back to my YouTube channel. Hope you guys are doing great. In today's video, I'll be talking about the 5 P's of labor and delivery. But before we do that, please, if you're just coming into my YouTube channel for the very first time, please subscribe and turn on the bell icon so you won't miss any of my upcoming videos. Okay, thank you all for doing that. So the 5 P's of labor and delivery is a very important aspect for all midwives to be aware about. But I'm interested in sharing this knowledge to all pregnant women and their families because it's very important. Without these 5 P's, labor cannot go successfully. And these 5 P's have to do with a woman having a normal vaginal delivery. And in order for that to be possible, all these 5 P's need to be available. So the first P I'll be sharing with you all today is the passenger. The passenger is that fetus or baby in your womb. So for a woman to have a successful vaginal delivery, the fetus needs to be in the best position. And the best position of a fetus in order to ensure a normal vaginal delivery is the occipital anterior position. And the second factor is that the passenger, which is that fetus, needs to be in the perfect presentation, and that is a cephalic presentation. The cephalic presentation means the baby is presenting with the head towards the pelvis. So these are some of the characteristics of the passenger. So these characteristics will ensure that this woman will have a good normal vaginal delivery. And another characteristic of the passenger is that the passenger should have a size that will enable him or her to pass through the pelvis of the mother. Now moving on to the second P, which is the passage. This has to do with how gynecoid the woman's pelvis is. It's important for you all to know that there are 4 pelvis in midwifery. That's the android pelvis, the gynecoid pelvis, the platyploid pelvis, and the android and the anthropoid pelvis. But the most important pelvis, the pelvis that is required of all these women, is the gynecoid pelvis. Because this pelvis is round in nature, it has no prominent ischial spines. So there are no obstructions in this pelvis that will prevent the baby from passing through the mother's pelvis. So these are some of the characteristics of the passage. And the passage also needs to have a good cervix. That the cervix needs to be thin, the cervix needs to be short and the face. The cervix needs to be soft enough for the baby's head to easily push and pass. So these are some of the characteristics of the passage. Now let's move to the third P. The third P is the placenta. So for labor and delivery to occur successfully, that's for a woman to have a normal vaginal delivery, the placenta needs to be properly situated in the correct position. And the placenta does not need to be abnormally low in the uterine segment. That's the placenta should not partially or completely cover the opening of the uterus, which is the cervix, because this will serve as an obstruction for the passenger, which is the fetus. So it is very important for the placenta to be properly situated for labor and delivery to occur successfully. Now the fourth P is about the powers. The powers are the contractions. So for labor to occur successfully, these contractions need to be strong. They need to be good enough. A woman cannot be in active labor that she cannot be at 4 centimeters dilated and she's sleeping. Then something needs to be done about those contractions. Because this is how I always explain to women in labor. I put it to them as plain and easy as possible. I tell them that, Miss, here is the thing. The fact is, labor cannot occur without contractions. I mostly tell them when they are calm, because when you're telling them all these things, when contractions are going on, it's like you're wasting your time. So you tell them when they are calm, because when there are contractions, they start asking of painkillers or tell you to stop the contractions. So you need to reassure them. So what I tell them is this: these contractions, what they do is they help push your baby. they give your baby that power to go down. And when they put your baby's head applies on your cervix, on your root. And when that baby's head applies on that cervix, it mounts pressure on the cervix. And with each contraction, that baby keeps mounting pressure on that cervix. And that's what causes the cervix to dilate. So this is how I explain to them concerning the contractions. So for labor to occur successfully, these contractions need to be there. The powers, which is the contractions, need to be there. They need to be strong. They need to be strong and they need to be frequent. Because we have two types of labor. We have true labor and forced labor. With forced labor, a woman can have a contraction now and maybe has the next one 2 hours or maybe a day later. That is forced labor. But with true labor, especially in active labor, those contractions need to be frequent. So she doesn't have to be sleeping throughout the labor process like nothing is going on. Now the fifth P is about the psychology of the woman. These women have the power to control that labor process. Because if they say they can do it and they can go through this labor process, then they will go through it and they will have a successful vaginal delivery. But if they say no, they cannot do it, then automatically they will not do it. And most women will say they will not go through the process, that is too painful, they are tired. Most of them end up in the theater. That's most of them end up undergoing a cesarean section. So it is very important for you to educate these women, encourage them, and make sure that they build a positive mindset towards labor, because their psychology matters a lot. So guys, these 5 P's that I've shared with you all today all work together. If 1, 2, or 3 of them are absent during the labor and delivery process, then this woman or a woman in labor cannot have a successful vaginal delivery. So the passenger must possess all the necessary characteristics. The passage must possess all its characteristics. The pars must be involved. The placenta must be in the right position. And the woman must have a positive mindset towards normal labor and delivery. So guys, this video is very important. Please share it, subscribe, and turn on the bell icon so you won't miss any of my upcoming videos. Thank you all for watching. This has been Boris the Midwife. I will see you all in my next video.